And thank you very much for joining us here on PM Express. This is the morning after the president addressed the nation with, 29 days to a major election and told us that, we've all been sleeping on the job when it comes to COVID-19. And the update is that the situation apparently, whilst we all were in our slumber, COVID was sneaking back on us quite gradually and is beginning to take a toll. It's pretty strange because this is happening at the same time when the rest of the world is beginning to see a surge in COVID-19. What really is happening with the Ghana example? We're going to go through the new wave and the new strategy for you. So this for me is key in terms of looking at what we're going to analyze today. We know what the problem is. And let's go what the problem is. The president told us a bit of that. That the public cautioning us about the need to take the COVID-19 safety protocols seriously. Why is that? Because we're seeing that there's a surge in the numbers of the active cases. What is the numbers? The numbers tell us that active cases have surged 500. The president last night gave us an update of just a little over 1,156. If you look at the cases as we see tonight, I'll update you shortly because the Ghana Health Service page is giving us a quick update on this. And so we are currently at an active case. It used to be 500. We are talking about 1,000 plus. 1,156 is a number, which of course tells you a story, right? And even here, many say it is a bit understated. Why? Because this can be determined by testing. And we know that our testing regime is not as active as it used to be in the early days of COVID. That's considerably tailed off as well. It's not as aggressive. Our testing regime isn't as aggressive. And that is why possibly we're seeing these number of active cases could be far more than this. But let's work with what we have. So that's it. The cases themselves currently stand at 49,000. And if you compare this to what we're seeing elsewhere in the world, this is a drop in the mighty ocean. But doesn't mean that we shouldn't worry. Deaths, 320. That is possibly the reason why people are not taking it seriously. Today, we sent our reporter out to a market in Kaneshie, and he spoke to some market women. Some fascinating reactions we got there. Some of the market women told us that, listen, I haven't seen anybody die. I'm here. Thousands of people are around me. I haven't seen anybody die. What are you talking about COVID-19? Corona. So that is the feeling out there. I haven't seen anybody dead. And he says the face mask was disturbing them. They couldn't, shout and advertise their words enough. So they've thrown it away. There's nothing there for them. And so obviously it's an issue. But I think really systemically throughout, everybody else had taken the eye off the ball. Not only the market woman, not only journalists like myself, but everybody else seemed to have taken the eye off the ball. We stopped talking about it, and when we stopped talking about it, people seem to simply just go on with their lives. But this is good news, as I always indicate to you, because recovered cases is at 47,726. This is good. We're doing some work there when it comes to this. But the biggest impact of COVID, that's when you begin to notice that you're failing, is the impact on the hospitals, right? So what is the story there? I haven't heard that yet. I want to interrogate that when we sit with the Ghana Medical Association. What is the story on hospitals across the country? Because everywhere in the world, where you begin to feel the impact of COVID the most, you can deny it all you want, but the hospitals will expose you. Because people will go and they'll show symptoms and they will die. And the doctors and the nurses will see it. Go to Brazil. Their president denied it for as long as he wanted, but we saw the coffins. The hospitals were overwhelmed. It could show in the hospitals. So what is it? What are our hospitals telling us about COVID? Or this latest report of a surge may be exaggerated. We'll come to that. Now, number of daily infections on the rise, and this is where you reduce it to the very basic level. An average of 25 new cases per day, that's what it used to be. It shot up to 130 cases, threefold it's gone up per day. just in the course of 2 weeks. Something is happening that we need to try and pin on and try and fix. 172 positive cases have so far been detected, we understand, among some 54,000 international passengers. And so many will say, so it's not because of the reopening of our international airport that we are having the surge, because this is too small compared to how many people have come in into the, it can be this. So if it's not this, what is it? Death toll stand at 320, as we know, new GHS survey. Maybe here is where the story is, because the GHS survey suggests compliance rate with the wearing of mask has fallen from 44% when we started this to 5% now. That is a significant drop. We all stopped wearing face mask. I mean, I must admit, sometimes I forget my face mask until I enter in a shop and I see this sign that says no face mask, no entry. Then I go back to my car. Tell me it hasn't happened to you. But back in the day, even when you're in a car alone, you actually didn't forget that you're wearing your face mask. We all need to sort of re-energize our thoughts when it comes to COVID, because as we see, it's getting worse. Now, so what are the measures government is reintroducing? The Ghana East 100-bed Ghana Infectious Disease Center will be open in the next few days, you understand, to deal with the rising cases. Severe sanctions per persons who disregard the safety protocols, including wearing face masks. The police also went to bed. I mean, they stopped and fought. You just walk around the town and see the trotros. Nobody's wearing it anymore. There's no social distancing anymore. Everything is just gone. The politicians themselves are the biggest violators of the laws they pass in Parliament. They are campaigning across the country. And you haven't seen social distance at the rally. They are holding the rallies, the small gatherings in communities. It's just not there. But they are telling us that they're going to punish us. Well, we'll see. Incentive package for health workers extended to the end of the year. That's good news for the health workers across the country. Health workers will not also pay income taxes from October to December. Only time I want to be a health worker. Very interesting also for them in terms of the work that they've done. You need to applaud them because they've kept us alive all through this period while they put themselves at risk. Also, now we also know that frontline workers will continue to receive the additional 50% of their basic salary per month from October to December as well. They deserve this and even more. So tonight, what's the new strategy in the wake of the wave that we are experiencing? I want to bring in right now my guests who are joining me. Dr. Michael Owusu is joining us via Zoom right now. We'll also be joined by the Greater Accra President of the Ghana Medical Association, the Ghana Health Service boss, Dr. Kuma Boaje, will also join me tonight as we begin to go through this phase and discuss what we can do so we win back and go back to what we used to be. I want to go to Dr. Michael Owusu with the KCCR. Of course, he's a virologist himself who joined me right now. Doctor, tell me, I mean, you had the president yesterday in the picture he painted of the surge. What for you will you put your finger on as the explanation why we are witnessing, call it a surge?
Good evening, Evans, and good evening to all your viewers. So I think that it's been some time since this whole pandemic started, somewhere in the month of March, where we had a lot of discussions and made a lot of projections about the virus. And as you will expect, if you look at this virus, SARS-2 coronavirus, what we know is that it follows an epidemic curve. And the epidemic curve is what others may term it as a Gaussian distribution. It starts from an acceleration phase, hits a peak phase, and then goes to a deceleration phase. And with the proud knowledge that no one has an absolute immunity to the virus, we knew that when the virus came into the world, the sister strains of the virus, which is the SARS coronavirus, the other NL63, OC43, and all the other related viruses could offer immunity for up to 3 years, but we're not too sure how this one could take us to. But with what is happening, and few studies seem to show that you could have immunity for about 4 weeks to about 52 weeks. So the second waves and third waves that people are recording is more of confirming what has been seen experimentally in the lab. That it could be that people are naive, to this new virus for which within the first epidemic phase, they were never exposed and therefore were never infected, or people who have been exposed already and then looks like their immunity has waned over time and they have been exposed again and have been reinfected again. What is contributing to these waves across the globe? So if you look at the virus theoretically, it has to go through this phase, and you keep doing this until we get a vaccine. Until you get a vaccine, you cannot stop this. You go through a first wave, second wave, third waves, and you keep on doing this for a number of times. And as we say, once you cannot be immune forever, it will keep dropping and going back until one day we hear a vaccine has come and everybody, has taken the vaccine and becomes immune to it. So this is to be expected, that if you have this virus come to your country and you don't manage it very well, and then people don't adhere to protocols and go by their normal duties, then of course you begin to see surges and spikes, what is reflecting in what the president announced. So, to take it through what you just said, somewhere in October, which was about 398 active cases, meaning those who have been infected and are moving around, either hospitalized or asymptomatic. And within almost a month, you have over 700 additions to this, which is quite worrying because from the 18th address of the president, the target was to get a zero active case count, which is what all of us were looking up to. But this was based on the condition that people will adhere to the protocols and behave well. So normally, and not only Ghana, in many other countries, once people don't behave well and don't adhere to the protocols well, you seem to see some of these spikes occurring. And this is what I think the president is much worried about. And many of us are also worried about that. If we don't adhere to this protocol, then of course, we may get to a point where what others are seeing is what we may also see. But for now, we are not yet there, but it's a signal that we have to be very careful and manage our situation and bring it under control so we don't get to where others are.
Stay with me because in the studio I've just been joined, of course, by the Greater Accra president of the secretary of the Ghana Medical Association, Dr. Winfred Ba. Doc, so first of all, from the health worker point of view, what is it that you pull this down to?
All right, thank you and greetings to all our listeners. Yeah, so like Dr. also said, we've all noted that the cases have been going up. We've been getting reports from the health workers, and usually for the cases to go up, there are usually two things: either the virus has mutated, or probably we are not taking the measures as we are supposed to. But studies that have been done so far show that there's been no mutation. So it's all boiling down to we not adhering to the preventive measures. And so we think that that is what is probably contributing to the increase in cases.
Okay, so we are not observing the measures, but we've not been observing the measures for a while.
Yes, so if you look at it...
Because, I asked that question because the non-observation of the measures, it's not... Because the analysis that the president gave us, stuff that we probably have beginning to see over the last 3 weeks, sort of the incremental. But for a long time, we haven't seen an adherence to the measures. But we didn't see it at that time. Why are we seeing it now?
No, so if you look at the Ghana Health Service survey, the first time they did the survey, adherence was about 44%. And just the recent one they did, it's come down to 6%. So that should tell you something has changed. People are not adhering. And we think that is contributing a lot to the increasing number of cases we are seeing. We are in the hospital. Sometimes people, when it started, the measures were very strict. Now, people come to my hospital in Kolebu and we used to check them and all of that. All those have relaxed. Everybody, it's not just the patients, it's not just everybody, even the health workers, we think that everybody has relaxed. And it's quite usual with human behavior change. There is a phase called the maintenance. When you look at the trans-theoretical model of behavior change, there are 5 stages. The 5th one is maintenance. if you don't reinforce the behavior at that stage, people tend to relax. It's because, like somebody said from your survey, have not seen anybody die.
Yeah.
So why should I still continue wearing this? It's not comfortable. I mean, changing behavior, it's not easy. So why should I continue to do that? You know. So I think that we are all at fault. But the good thing is that, and I'm happy you've called for this discussion, because we must all get back and say we need to maintain the positive gains that we have made.
Yeah, I mean, Dr. Michael Owusu, so to that point, so we track the increases that we've seen. I mean, something that Dr. Bam mentions that struck me was that even at the hospitals, the doctors and the nurses have stopped being as strict as they used to in terms of checking MP. I'm even not sure people even wear PPEs anymore nowadays.
No, we do, but it's not been as strict as we used to.
Yeah. I mean, remember back in the day, the PPEs were talking not just this and gloves, full protective PPE.
So that we do at our treatment centers, and that is being done. I must say that about a month ago, the treatment center at Kolebu, we had only like 2 or 3 cases. We had to shut down some of our treatment because we didn't have patients. And then suddenly, we saw that our treatment center has gotten full. Now we need to reopen all the other ones that we've shut down. You know, so, and at that time, a lot of people were not really, like I said, I'm just being frank. We were not as strict as we used to, because we thought that we've overcome it. But like I said, that is the thing. Once you lose guard.
Yeah. So the question I was raising earlier when I was doing the facts. Are you seeing the result of this? Because I say the ultimate place of evidence for a COVID ravaged place is the hospital. Yeah. Because you can deny all you want. People will fall sick and come to you. Yeah. Are you seeing an increased number of cases reporting to the hospital?
Sure. That's what I said. So, like I told you, about a month ago when I was on duty at the COVID center, we had to even close down some of our wards because we didn't have enough cases. And at the Fevers unit, we had only 3 cases when I was on duty about a month ago. Now, the Fevers unit our center there is full, and the wards we have closed, we now have to reopen them. We are seeing a lot of cases, even on the wards now. They are not presenting what we call atypically. Most of them will not come with cough, maybe some weird neurological symptoms. And then you test and then becomes... So we have some of the wards where we have positive cases. We didn't suspect them initially, but later on you have to do... something triggered it, and you do it, and they become positive. Then we have to move them to the treatment center. So we are seeing increasing cases now, at least from Kolebu.
But that isn't necessarily into deaths, right? I mean, are we not seeing that impact on fatality?
Yes. So currently, I think we've had just about 2 deaths, but those were people who were very sick. Some of them had some cancer, so we can't attribute all to COVID.
Okay. Thankfully, the Director General of the Ghana Health Service has just joined us. Dr. Kumabaji, thank you for your time here on PM Express. Oh, I think we've lost him there. I mean, let me bring back Dr. Michael Owusu. Doc, so let's go back to the fundamentals. So the GMA puts this down to laxity in the adherence to protocols. Is that the sole reason? You've mentioned that there could be other factors, but if the measures are lax, the president has said that we're going to now start enforcing it. The police are going to go out there and do more. But then also is a question about testing. Remember when we started this fight globally, it was 3 words: test, test, test. I didn't hear anything about that extensively. The president said, in essence, that they're going to enhance measures of tracing, testing, and treatment. But it almost appears to me that we stopped that. We stopped it. I mean, at some point. Do you get the same impression as we wait to get Dr. Kumabaji on the line to get clarity on this? Did we stop it and we are now restarting? And the testing regime that we have, you are the KCCR, so maybe you can shed some light on this. How rigorous is the testing that you still do compared to what you used to do before?
it's good to understand the strategy that the country is using with regards to testing. And then what you do at the acceleration phase it should not necessarily be the same as what you do when you are at the peak phase. And what you do at the peak phase is also not what you're supposed to do when you are at the deceleration phase. So if you remember, when somewhere in March, in April, the Ghana Health Service adopted a strategy where you have to test within 2 or 3 kilometers of cases where people are and are supposed to be having infected. You remove these people from the populations, you follow up their contacts. And these were done in a bid to get as many people as possible and remove them from the population so you can slow the transmission. So we did this for some time until we got to a point where many people now, were hospitalized. People had symptoms and symptoms. So it was important that we now channel our resources to testing patients so that when we got to that point, they came with a strategy that we now have to focus on those people who are sick. And it made a lot of sense because it wouldn't make sense to use test kits for which you don't manufacture to be testing populations where you know that about 60 to 70% of the people are already infected. It's good to channel this to the health sector. So the focus was now about those who are sick. You test as many as possible, you provide them with care, and then reduce deaths. At the acceleration phase, this is what we're trying to look at. You make sure that you provide care, and then at least you manage the cases that you have. Now that we seem to have surges, across board, the Ghana that I know very well that is trying to look at the 3 T's, what is what the president mentioned: contact tracing, enhanced testing. And I think that things have improved than before. Somewhere in March and April, KCCR and Noguchi were the major one that were tested. We had about 2,000 test capacity. Noguchi had about 4 times of that one. As we speak now, we have set up places like the North. In Tamale, we've set up places like Kintampo. We know Upper East, Upper West, Sekondi, and many places are testing now. And in addition to that, the travelers who are coming in are also serving as a whole cohort of population, which enables us to monitor how the transmission of the virus is going through. So most of the data is not just coming from us. It's coming from different places, even including private facilities.
Yeah,
which gives us an upper hand
Doctor,
we used to know before. So
go on. I wanted to bring in the Ghana Health Service, but the line has dropped again. Go on.
Yeah, so Evan, so what I'm saying is that in terms of trying to monitor and understand the virus transmission and knowing very well where there are spikes, we seem to have better control and better knowledge of this than before. At KCCR, when this started somewhere in March and April, we knew that if you run every 100 cases, you find about 1 out of 100. And then somewhere in the month of June and July, we had about close to 60 out of every 100. Close to August, it was about 90 out of every 100 cases that comes to us. And as we speak now, we went about 5, and now it's about almost 5 to 10% for every 100 PCR plates. So right from, in our own closed lab, we can monitor and understand out of every 100 cases that come to us, how many of them become positive. And this gives you a better understanding of the new incident cases, which will tell you whether their transmission is going up or going down. So depending on where you are in the phase, in this early phase where we think that cases are surging, it is possible that we have to expand testing, target as many as we can to enable us understand the people who are carriers, remove them from the population, and slow the transmission.
Yeah, so I have a question though, and I want to take a break. We're going to turn around. I'll come to that. The new strategy is going back. It's not even new because it's a tried and tested way of dealing with this: tracing, testing, and treatment. Tracing is very effective when community spread is not as bad as it is right now, right? What we have currently is
yes.
Even gone beyond community spread. It's gone haywire. So I wonder how effective tracing will be in the current COVID climate where it's everywhere. I want to take a break. When I return, we'll assess that new strategy a bit closely and get the input from the GMA on this, and hopefully get Dr. Kumar Baji on the line for some clarity on some of the issues going forward. Stay with me. It's live here on PM Express. Tonight we're looking at the new wave and the new strategy when it comes to COVID-19, as we've heard from the president yesterday, and of course today there's been an update on the active cases. On Zoom with me is Dr. Michael Owusu with the KCCR, and in the studio with me is Dr. Ba, who is the secretary to the GMA in the Greater Accra region. Doc, let me come back to you. So just before the break, we're talking about the new strategy. Yes. Okay. I mean, for the Ghana Medical Association, the strategy that, what is your understanding of what the strategy that we have now, before even the president told us about where they're going? Were you happy with the strategy you saw implemented as far as COVID was concerned prior to, say, yesterday when the president spoke to us?
All right, thanks. So, I mean, there's no doubt that the strategy we use as a country worked. I mean, if you look at the curve, you realize that, like Dr. also said, there's a deceleration. So somewhere a month ago, we're all very comfortable. We're all actually happy that we've almost defeated COVID. You know, so I think the trace, test, and treat worked. But you all agree with me that along the line, these measures were all relaxed. And I think it got to a point, contact tracing wasn't done as vigorously as it used to at the peak of the thing. All right. Now, and probably understandable because they thought that things were under control. And so I must say that although we're doing the 3 T's, it was not as vigorous as it used to be. And probably that is why there was a breakthrough and the cases are increasing. Now, when you talk about strategy, we think that we must reinforce what we used to do. I mean,
which of them specifically?
Yeah, so from our part, we want to reinforce, make sure that people get to know about the preventive strategy. So with the Ghana Medical Association, I mean, under the leadership of our president, we started a nationwide campaign. All right, so all the regions are doing it. And of course, because most of the cases are in Greater Accra, we have started vigorously. So we've started educational campaigns. We are in partnership with the NCCE, and so we've booked times with the churches, mosques, second cycles, and then some of the markets. We have started already. You are going to see a lot of our works in the media, on social media and print media and the rest. We've already done some publication in the Mirror and the Daily Graphic last week. You hear us a lot on radio and TV from this week. What we want to do is to drive home the fact that COVID is still there. A lot of people, especially when you go outside Accra, people just don't wear their masks. They don't observe the social distancing. And don't forget, we are in the campaign season, so people are aggregating and a lot is happening. So we want to sort of create the awareness and say we need to maintain the behavior change that we've done so far. We need to keep the gains. We don't have to lose our guard. And so the GMA is in partnership with a lot of institutions. And all over the country, you will hear us. I'm sure this is just the beginning.
Yeah, I mean, Dr. Michael Owusu, so to the strategy now, the new strategy, well, the revived strategy is tracing, testing, treatment. And I was making the point earlier about the tracing bit. Should this still be part of our strategy, the tracing bit? Now, seeing how widespread community spreading has become, would that be an effective tool in the arsenal that we are deploying now?
Yes, Evans. This is a tried and tested tool that works very well. And just to let you know that since March, when this first came to the country, the government has made a lot of effort in expanding the testing that we have. And as I told you before, it used to be KC and Noguchi, but we have over 16 testing sites that we have also helped to set up, including the private sector, which I believe is quite robust to be able to detect these significant rises in cases. But to come back to the strategy, so as I said earlier, Now, if you look at the epidemic curve, we have crossed the peak point, have entered the deceleration phase. So if you have cases now beginning to rise, it's like you are starting a new thing all over again. One, because there are people who maybe were naive to the first exposure. So they were never infected. And because the cases went very low, we open up and they have come to mingle with populations. So these people will now become infected again because in the first case, maybe they escaped. Then you have another population who were infected before, but then they could have immunity that has waned over time. And therefore, you could have recording of reinfections that occur. So when you have these activities going on, then of course, the effective strategy in order to slow the spread is to deploy contact tracing, to deploy testing, and to ensure that at least for many people who are exposed and infected, you remove them from the population. So it is as if you are starting again. And this is why people normally will term it as you have to work so that you don't enter into a second wave. Because when the second wave comes in, you do everything as you did before. So you slow the spread and you delay, the progress of the infection. So you don't have many people move.
Will you describe what we're experiencing?
Is the tool that has to
will you describe what we're experiencing right now as a second wave? Does it qualify? Hello, Doc. Yeah. I'm asking whether you would describe what we're experiencing now.
Yeah.
Will you describe what we're experiencing now as a second wave? Does it qualify?
No, Evans, I wouldn't describe it as a second wave. And let me explain this to you. So I've looked at the data. If you say a second wave, it's like having a sea with the waves. And the wave we talk about is a wave of an epidemic curve, where you rise, you hit a peak point, you descend, and then you begin to rise again. So what people are calling second wave is especially when they have two peak points. They normally compare the two peak points. And let me give you an example like in Belgium. Belgium had its first case somewhere on the 9th of February with just about one or two cases. By the month of 10th of April, they had about 2,000 cases. It was the highest new cases they had so far within the epidemic cycle. And then after that point, they began to have a decline in the number of new cases. And then somewhere in October, they now have about 12,000 new cases occurring. So the second peak point was higher than even the first one. The same thing was in Germany. They entered about 29 February, they had one or two cases. As of 5th April, they had about 6,000 new cases. It was the highest point they had. And then after that point, they began to enter into a decline phase. And all of a sudden, by 14th of April, they hit about 8,000 new cases, and it's still going up. Spain, Russia had the same pattern. If you look at our cases as we speak now, the number of new cases is about 198. The last time we had the highest number of cases is somewhere on the 5th of July. It's about 1,200 new cases. So the threat of a second wave, but then we have not yet entered the phase if you look at what others have experienced. So for me, I think that it's more of something of what is to come, which is why we must all ensure that we work towards it.
Are you projecting,
that phase?
Are you projecting that this might get worse again?
Sorry, Evans, if you can.
I'm just asking whether you, based on your analysis, and you know the way the virus sort of works, that with the evidence of what we are seeing recently, that it might get worse again?
Yes, Evan. So, well, I think that where we are now, there seems to be an awareness, an awakening across all the different parts, ensuring that people adhere to these protocols. So if with the strategy that we want to deploy, as in contact tracing and testing and treatment, if we are to fully deploy this and ensure that people take these protocols more seriously and do what is right, I don't think we are likely to get there, because as we always say, for this African populations where the virus itself is quite mild, many people are asymptomatic. So if you put in a little effort in terms of putting on masks, ensuring that you observe the protocols, you have a better chance of reducing active cases for people who are sick, so you don't enter into a place where, a state where the facilities become overwhelmed.
Yeah,
having hospitals becoming overwhelmed is one of the clear signs and symptoms that you entering into a phase that
I mean, and I've heard the GMA secretary with me say that they've seen rising cases at the hospital. So that clearly is something to be concerned about. Thankfully, Dr. Kumabaje is joining us via Zoom now. And Doc, thank you that you managed to make time to speak to us.
Thank you.
Great. Yes, thank you very much that you could join me. So tell me, I mean, your survey gave us an insight into why we are seeing this rise in the cases, as in people are disregarding the wearing of face masks. The Veronica Buckets have disappeared from the shops and from the markets, etc.
Yeah, so I lost you a bit.
Yes, can you hear me?
Hello.
Yes.
I can hear you now, yeah.
Great. I'm saying that your survey gave us a sense of why we are seeing the increases, right? I mean, did the system, forgive me, did the system drop the ball on this? I mean, you put in so many measures that has been applauded by my guest tonight, right? Did we sort of losing the grip on the virus? I mean, at the system level, Ghana Health Service, government, everybody else. I mean, what was it that led us to this point again? I think Dr. Kumabaje's video has frozen.
Yeah, sorry, the network is.
Yes.
We didn't drop anything. We continue doing exactly what we're doing. Mm-hmm. But like we keep saying, this is a two-way affair. It's what the systems put in is how the people respond. And I think adherence to the protocols, etc., got down. And like we were saying, that we're also having some challenges with people testing outside the system, and so not getting the public health system to be able to respond appropriately. But most of it is mainly as a result of the fact that the protocols were not adhered to. And you see, no matter how many interventions we go, if people are not protecting themselves, the risk of spread is there. But like we're saying, it's been picked up early, and we started interventions more than 2 weeks ago when we started seeing the initial spread, as we have always done. And we've identified some of the challenges. We're improving not just contact tracing, but also to streamline testing so that people who get tested are linked to the system, and then the system can respond appropriately. So that was one of the key challenges. We are having some workplace outbreaks. One will not see it as a systematic outbreak across the community. And the rest of the 15 regions are generally quiet as normal, not much. You are not getting any surges in the regions apart from the districts in Accra. So that's what we're looking at. We've also had the airport come in with a few positives that has been described this morning, 178 so far.
Yeah. And
we are also having to do testing for sportsmen, etc. These are all areas that we are trying. So maybe see a few. That's another way of trying to get ahead of the virus instead of waiting for the virus to catch you on our own. And so the system has no slack.
Okay.
Contact tracing, as was mentioned, is a function of the number of positives. And so as numbers go up, more contact tracing will be done.
I mean, for the arrivals at the Kotoka International Airport, I mean, how are we managing them? So when you realize that he is positive, what's the protocol? What happens to him? Are they self-isolating themselves, or we're using the same measures that we introduced at the beginning, where we took them to a particular place where we can monitor? What's the management protocols now?
Yeah, Evans. Hello?
Yes, I can hear you. Can you hear me?
Yes. So the protocol is straightforward. Once, we have a two-stage testing. The first stage is that you have a negative PCR before we're playing. And that means that the people who are positive are not going to come. It's only those who are negative who can board. But because we have a second test on arrival, because we know the nature of the virus and the disease condition, we pick, as soon as you are picked positive, you are sent to the Gais Hospital for triaging, which we have a holding room at the airport. They are sent to the Gais for triaging. The triaging is to ensure that you don't have any underlying condition, you are not sick. And then we also look at your home environment, whether are you able to.
We may have lost him there. Hopefully his video can be stable enough so we can get to hear him. Because another thing I want to hear from him is to give me an update on the testing, our testing capacity now. I mean, what are we doing? How many are we testing a day? And do we have, okay, he's back. Yeah, Dr. Kumaba, we lost you briefly. Yeah, you were making a point about the arrangements when you test positive at the airport.
Yeah, so you are sent to the Gais, you are tried to make sure you are not having any underlying condition, check to ensure that you are not sick, symptomatic or asymptomatic, and then we also check your home environment to see whether you need hospitalization or if you can go home, are you able to self-isolate? When all these circumstances are done, decision is either you stay in the hospital or go to your home for self-isolation, and then the district will follow you up to ensure that you're okay. We also go back to see where you are seated in the plane, and the people sitting two seats on all sides becomes our contact that we have to trace and follow up and make sure that they also stay safe and don't become positive. So that's the protocol that we've been applying.
Also, please talk to us about testing. What is that testing capacity now? I mean, we used to do a lot on a daily basis, thousands of tests. Well, what is it now? Are we still doing as much as we used to?
I'm sure that also Mike will tell you, we have an excess capacity as far as testing is concerned. So far, we have about 23 labs. We have about 6 gene expert centers, and we are adding 25 more. And so, but the number of tests you do depends, as we keep saying, it's your testing policy and the number of positives. And so,
we may have lost him there again, because that sounds like a very good news. I mean, in terms of just the ramping up of the testing facilities we have. I want to take a quick break. Hopefully, by the time we come back, he can wrap it up for me on that point, and then we'll wrap up with my guest on, I mean, the tracing, testing, and treatment. What else do we have to do to it? I didn't hear education. I think that's a key point, right? I mean, because some of the market women told us that they become last because they sort of stopped hearing the major bars around COVID-19. So they thought, well, the virus may have gone, and that's why the system had just stopped putting it out there. So we'll talk about that also on return. Stay with me. Still here on PM Express. Let me bring in the Dr. Brown. Dr. Brown. So I mean, we've talked about the virus, but there's also the welfare of the health worker, right? The president, in his speech yesterday, laid out a number of incentives that will either be maintained or extended, and a raft of things. I'm sure that you've seen and excited about that they're going to maintain. The incentive package for health workers extended to the end of the year. All health workers who will not pay income taxes for the month of October, November, December. All frontline health workers, as defined by the Ministry of Health, will continue to receive your additional allowance of 50% of their basic salary per month for months of October, November, December as well. Yeah. This must be pleasing.
Yeah, I think that's good news for the health fraternity, not only for doctors, but for all frontline health workers. And I think it's good because when you keep motivating your staff, then you expect to achieve more results. And when you're achieving results with your staff, you need to keep motivating them to keep the gains. And so I think that was a very good announcement by the president.
Okay, I mean, so everybody happy?
Yes.
I mean, in the early days, you had a lot of concerns. It appears that, well, the PPE is not an issue anymore?
Well, because we didn't have many cases, so the little we have was enough. Those days it was a big issue because we had a lot of cases, and so they were not enough. But now we are quite okay. At the level at which it is now, we are okay. But if it surges up, then we are going to have issues.
Okay. But from what you've seen, I mean, if I talked about the steps, the new strategy now, of course, the revised strategy is to track, trace, test, and treat, right?
Yeah.
But missing in that, it is a revival of the education campaign and then enforcement.
Enforcement, yes.
Right? That must be a big part of the strategy going forward.
Exactly. And that is what the Ghana Medical Association has taken up, the education bit. As I speak to you now, we have recorded videos. We've had posters in various videos in various languages, not just in English. And from tomorrow, you start seeing them. They will be on the TV. They will be on radio. Our people will be going out to the markets, to the mosque, to the churches. And so we have taken the education part very seriously. As we do the trace, test, and treat, we also want to do, because the education is very key in this. If we want to break the chain of transmission, we need to be up on our education. And so the Medical Association all over the country is taking that up very seriously.
Okay. Dr. Kumabaje, you were, before we lost you there, you were wrapping up on our testing capacity. You've given us some impressive numbers about our testing capacity currently. I wanted to finish on that because that was one of those pleasing things about, I guess, the benefit of COVID. If there's anything like benefit, it's pushed us to put in infrastructure when it comes to testing.
Hello, Evans.
Yes, sir. Can you hear me?
Yes.
Okay.
Yes, I can hear you.
Yeah,
yes,
on the testing.
Like I said, yes. If you talk about the testing capacity, that tells us how many tests we can do, for example, in a day. That has significantly increased with the private sector labs joining, the public sector labs being expanded into almost all regions now, because we have Navrongo, we have 2 in the northern region, we have Kintampo in the Bono East, we have 2 centers in Kumasi, and of course the Takoradi and the rest in Accra. Now we have gene experts centers in 6 of our regional hospitals and teaching hospitals. And so the capacity is there. In fact, we are currently underutilizing our capacity because we are not having to do so many tests. We are responding to the number of positive in their contacts. And so if the numbers are going to go up, we'll be able to respond and still be able to deliver results within 48 hours.
Fantastic. I'm grateful, Dr. Kumabaje. There's a lot to go through about, I mean, we need to have a show about the COVID benefit, because believe it or not, crisis brings the best out of you. And we've seen that even in this crisis, like 23 testing places across the country. Who thought when we started it was just Noguchi, and then KCCL sort of also inputted. Now 23, that tells you a lot. Both parties in their manifestos are now proposing to do great things in health, because COVID had exposed us quite badly. We need to track that. We've done a lot of negativity about COVID. Yes, it's negative, but you could spot there that there's some positive things there that COVID has forced us to do. Now we do Zoom, even for us media. Zoom wasn't a thing, right? Now it's become a thing. That's a conversation we'll have down the line. I'm grateful to Dr. Kumabaje. Thank you very much, Michael Owusu, Doc of KCCR, and of course, thank you very much again. I mean, you've been enjoying your packages. This is the time I want to be a doctor. Remember me.
I'll share with you.
Yes. Enjoy the rest of your evening.